The list of conditions relating to the degenerative conditions of the conjunctiva is quite long. Basically, we talk about the degenerations at the level of the epithelium, or it can be at the level of the substantia propria, or even the smooth muscle layer that is present at the base. So whatever the layer may be, we are basically relating to the degenerations that are taking place. Now, what are the causative factors for the development of this degeneration is again very important. And that would basically affect the final clinical picture in the patient. The patient would usually come up to you with the complaints of irritation in his or her eyes, as well as increased sense of lacrimation, increased sense of irritation, redness. Obviously, on careful examination, make the patient sit on the slit lamp and then you're going to observe what is the causative factor for the development of this increased lacrimation in this particular patient. And obviously the causes of the foreign body sensation and the irritation that he's complaining of. What would be the finding of the ophthalmologist is again very interesting. May it be the Pinguecula, which is one of the degenerative condition, or it may be the Pterygium. On the other hand, it can be the Concretions. All of these are basically the types of the degenerative conditions that can arise in the patient. There would be this mass that you're going to observe in the layman terminology. You're going to observe this mass on the conjunctiva. Mostly it's the bulbar part of the conjunctiva that is affected. Now, why is that so? Why is this bulbar part more prone to the development of these degenerative condition, whether it is the Pinguecula, whether it is the Pterygium or the Concretions? Because it is the most exposed part towards the environmental conditions. All of these degenerative conditions have one thing in common. It's basically the irritation, whether it is the dust particles, the allergic conditions that basically irritate the conjunctiva and results in the degenerative processes of the conjunctiva. So the bulbar part of conjunctiva is the most exposed part rather than the palpebral part of the conjunctiva. So we'd be finding these degenerative changes on the bulbar part of the conjunctiva particularly. We'll be starting off with these different sorts of degenerations. We'll go through their clinical features and what are the etiologies, that is the underlying pathological process that results in the final outcome, that is the degenerative process of the conjunctiva, and what is basically the triggering factor for the development of these Pingueculas or these Pterygiums and Concretions as well. So talking about the Pingueculas, it's the most common degenerative condition in the conjunctiva. You usually come across these condition, and as you can see over here, it's basically this yellowish white patch that appears on the bulbar part of the conjunctiva. It's usually a bilateral condition. Sometimes it is a unilateral condition. It's usually arising near to the limbus. Limbus is the portion of the conjunctiva, or it is basically where the cornea meets the conjunctiva. So basically it is going to appear near the limbus. It can be a unilateral condition, it can be a bilateral condition, it can be appearing singly in one eye, or it can be more than one appearance of the Pingueculas even in a single eye. So what is causing these Pingueculas in the eyes are again very important. It's basically the irritative factors. It can be the dust, it can be the wind that is basically responsible for the causation of these Pingueculas in the eye. We also have to differentiate this condition of Pinguecula from Pterygium. Pterygium is also a whitish, yellowish patch that is going to arise in the bulbar part of the conjunctiva most importantly or most commonly. But when we compare a Pinguecula from Pterygium, it's basically, a Pterygium is usually a triangular fold That is the most commonest shape that it is going to take in the conjunctiva. While on the other hand, pingueculas are rounded masses, rounded yellowish white patches that are going to appear in the conjunctiva. So this is the most differentiating feature. Obviously, when the patient would come up to you and the signs and symptoms that he'd be giving to you would be of the foreign body sensation that he's having in his or her own eyes. So there would be an increased lacrimation, increased irritation in his eyes, redness would be observed, and you also have to differentiate this condition from the other conditions of the conjunctivitis, whether it is the allergic conjunctivitis, most importantly, because the dust and the winds are also causing allergic kinds of conjunctivitis, but they're not going to cause these masses on the conjunctiva. There would be only signs of irritation, there would be only signs of redness in the eyes or increased lacrimation, and as well as the discharge is again very important and very peculiar when we're talking about conjunctivitis. So we have to differentiate the degenerative conditions from the infectious states and from the inflammatory states. Particularly, the inflammatory or the infectious states are going to have their discharge that is going to be a mucopurulent discharge, or that is going to be a sticky discharge, which is absent in cases of the degenerative conditions, specifically the pingueculas or specifically the pterygium. The discharge is going to be present, but it's just going to be the increased lacrimation rather than the mucopurulent discharge or rather than the sticky discharge that is present in cases of conjunctivitis or in cases of the autoimmune disorders or the sexually transmitted diseases, for example, trachomatis conditions that we have already studied. So this differential diagnosis is very important. Once you have a patient, it's very important to write down or jot down the differential diagnosis in this particular case of irritative conjunctiva. Then you're going to back down your investigation towards the final diagnosis, and that is only possible after a careful examination. When you ask the patient to sit on the slit lamp, you're going to carefully examine the patient, and that is going to reveal what is the causative factors towards the development of this irritation in this particular patient that we're talking about. So the etiology of particular cases of Pinguecula, in which we have this whitish, yellowish masses that are being formed on the conjunctiva. What are the predisposing factors for the development of this whitish, yellowish masses? Is basically they're basically considered to be age-related. So they're one of the changes of the wear and tear that is going on related to the age of the individual. So it's usually very common in the 5th to 7th decade of life of the individual. Then obviously it's more common in persons who are exposed to strong sunlight. So it can be the photosensitivity that is causing this particular kind of pingueculous degeneration in an individual. Pinguecula, very interestingly, we should know that this word pinguecula is derived from pinguis, which means fat. But it's not related to the fatty degeneration, or it's not the deposition of the fat that is giving this appearance of this whitish yellowish masses on the conjunctiva. It's just the external appearance, the whitish yellow patches that are related to the fat deposition, and that is why the word pinguecula was derived from the word pinguis, which literally means fat, but obviously it is not the fatty deposition on the conjunctiva. Again, it was also considered as one of the precursor of pterygium. So previously it was considered that it is basically that pterygium and pinguecula is one and the same thing, and it's basically the precursor of pterygium, and finally if it is left untreated, it is going to appear as that triangular fold that is going to develop, and it is basically the initial stages of pterygium that appears as this whitish yellowish mass, but it's not always the case in this particular condition. And then finally, any irritative factors, for example, the dust and the wind exposure is sometimes related to the development of this pingueculous condition in the patient. One should know that whatever these factors are, whether it is the age that is responsible for the development of this pinguecula, or it is some sort of an irritation, or if it's the strong light that is causing the irritation in the eyes of the individual, it can lead to the conditions which are most notorious, for example, the malignant melanomas, or even the keratomas. So all of these are the malignancies that can appear, and this benign condition, which is basically the pinguecula, can sometimes move on to complicate as the malignant conditions in the individual. So it should not be left untreated at any cost. And so educating the patient is again very important regarding this particular condition, and just to educate the patient that it is basically a benign condition, but finally it can take up the shape of some sort of a malignant condition as well in a lot of cases. So whenever we're going to go through the pathological processes of the pinguecula, we have these particular changes that are occurring at the histological levels. The substantia propria, the Bauman's capsule, or the Bauman's epithelium is sometimes deteriorated. It's basically the deposition of the collagen at the Bauman's capsule. And then it's also the hyaline deposition at the substantia propria that is responsible for these particular whitish yellow changes that are appearing at the gross level. And whenever we are going to see or examine the eye, we usually come across these whitish yellow changes. The changes are occurring at the level of the epithelium. It can be the deposition of the hyaline at the level of the epithelium, at the level of the basement membrane that is distorted, or it can be at the level of the substantia propria that these changes are taking place. So basically, the elastic degeneration of the collagen fibers is taking place as well. And sometimes we have the deposition of the amorphous hyaline material. This deposition of the amorphous hyaline material, it is taking place at the level of the epithelium. It is taking place at the level of the lymphoid tissue, or the substantia propria that is distorted. So it's basically the histological features. If we look at the conjunctiva, where these changes or these degenerative changes are taking place, and we're looking at them under the microscope, we'd see that the collagen fibers are distorted, as well as there is the deposition of the hyaline material at the level of the epithelium, as well as at the level of the substantia propria. So the whole histological features of the conjunctiva are going to be distorted at this level, and that is why this particular condition is grouped under this classification of the degenerative changes of the conjunctiva. These degenerative changes can be a part and parcel for the prolonged inflammatory conditions of the eye. So it can be one of the complication for the inflammatory conditions of the eye. Even some sort of a trauma can trigger up this process of the degenerative changes that are taking place at the level of the eye. So it can be the traumatic conditions, the prolonged or the chronic inflammatory or the autoimmune disorders, and all of the irritative purposes that can serve, for example, the photosensitivity, the dust and the wind. They can trigger up these degenerative processes at the level of the conjunctiva. And obviously, the bulbar conjunctiva is more prone to the development of these kind of conditions. The clinical features that we'd observe in this particular case, that it's usually a bilateral condition that is observed in the patient, usually a stationary condition. So sometimes it is not complicated, but obviously we cannot be quite well versed whether it is going to complicate in its statuary or not, whether it is going to remain benign in this particular patient or not. That is very important. The yellowish white patches is the particular sign, is the premonitory sign that we're going to observe in this patient, the triangular patch that is sometimes present near the limbus. So the most common site is near the limbus. The apex of the triangle is away from the cornea. So this is again one of the differentiating feature. Once we'll be studying the pterygium, the apex of the cornea is usually towards the limbus, and over here in this pingueculous kind of conditions, the apex of the triangle is going to be away from the cornea. It is usually affecting the nasal side first and then the temporal side. But sometimes it occurs simultaneously. The nasal and the temporal sides both are affected sometimes along with this particular kind of condition. Then we usually come across this congested conjunctiva. Why is that so? It's because of the foreign body sensation that the patient would particularly complain of, that he's particularly having this kind of a foreign body sensation in his or her own eyes. So that is basically going to relate to the irritative kind of conditions that are going to arise in the conjunctiva. It stands out as an avascular prominence usually. We have the conditions, whenever we have these degenerative conditions, we have basically two major kinds related to these kind of conditions. One, we have a progressive kind of pingueculous conditions, and on the other hand, we have the regressive kinds. So the regressive kinds of avascular, of the pingueculous conditions are usually avascular in their nature, and they're basically the avascular prominences that are quite commonly seen whenever we have this pinguecula, either unilateral or either it is involving both of the eyes in this particular patient. Obviously, if any condition is left untreated, it is going to complicate the situation. Even if it's a benign condition such as pinguecula, and if it's left untreated, it is going to result in the further inflammatory conditions of the eyes. That is, it can be the allergic kind of conjunctivitis, or it can be a superimposed bacterial or viral infection that can relate to this particular kind of individual. Then obviously the intraepithelial abscesses and the formation of these intraepithelial abscesses is also again very important. And then the superimposed infections, the pussy discharge, the mucopurulent picture that was quite typical for the bacterial conjunctivitis is going to complicate the situation. We're not going to basically see a particular isolated condition of pinguecula in this patient. There is going to be a superimposed picture in which the patient is also going to have a mucopurulent discharge, irritation in both of his eyes, and then these whitish yellowish patches. So that is going to be the point when we're going to basically relate this condition to a complicated pinguecula in this particular patient. Rarely the calcifications can occur, and obviously we have to differentiate these calcifications from the concretions, which are not basically the deposition of the calcium. So the doubtful conversion into the pterygium. So it's obviously not it's basically quite obsolete these days, but it was considered previously that pingueculas are the precursors to the pterygium. So sometimes this pingueculous condition do move on to complicate into this pterygial disorder, that is the presence of the triangular fold in the eyes of the individual. The treatment of the pingueculas would be mostly, first of all, we're going to start off with the topical treatment. And obviously, we're going to start off with the topical steroids, as it's not an infectious state. And if you compare this particular situation, when we studied the cases of bacterial conjunctivitis or the viral conjunctivitis, we usually avoided the use of steroidal topical drugs because it's going to complicate the situation. But over here, when we have this degenerative conditions in which we want to hamper down the inflammatory conditions in the eye, we are going to stick on to the treatment of topical steroidal treatment in this particular case. Obviously, we are going to surgically excise these pingueculous conditions, and we're going to maintain the hemostasis of the eye, and then we're also going to relate to the cosmetic values of the eye and the final cosmetic outcome of the eye. So we are also going to relate to the implants and the obviously the topical implants over here after the surgical excision of the pingueculas in both of the eyes, or if it is a case which is unilateral, then we're going to treat it accordingly. Moving on, we have these cases of pterygium. Now, what is pterygium? It's basically the triangular fold that is usually present. It's one of the very commonest conditions, which are basically grouped in one of the degenerative conditions of the eye. It's basically a triangular fold that is present, and the apex of this triangular fold is usually towards the cornea or towards the limbus. When we carefully look at this particular patient of pterygium, he'd be giving you the complaints of foreign body sensation in his eyes, irritation in his eyes, there would be redness, increased lacrimation due to this pterygium, and obviously a lot of patients would also complain of decreased visual acuity. The cause of this decreased visual acuity in these cases of pterygium is basically whenever this triangular fold is going to encroach upon the cornea of the individual, it is going to affect the visual acuity of the individual as well. So after listening to the history or the complaints or the signs and symptoms of the individual, you'd ask the patient to sit on the slit lamp and you'd carefully examine the patient. What would be the findings as an ophthalmologist? You'd find this triangular fold, and usually when you look at the anatomical features that are relating to this pterygium, it's basically this whitish fold. It can be avascular, it can be vascular as well, as we're going to study that there are two types of this triangular fold or this pterygium. On one hand, we have a progressive type, which is going to be vascular in its nature, and on the other hand, we have an avascular kind of pterygium, which is a regressive kind of pterygium. So it's basically going to depend upon what type of pterygium we are dealing with, and then on looking at this particular kind of pterygium, we'd observe that there is a head, a neck, and a body, and there's also a cap. So the cap is going to cover the head, and it's usually present in the regressive kinds of the pterygium. In the progressive kinds of pterygiums, we have the Fuchs spots, which are present anteriorly to the head, and they're usually present on the cornea of the individual, almost over here. So where the pterygium is ending, the Fuchs spots are going to be present over here, and they are basically the signs that are indicating that it's a progressive kind of pterygium that we're dealing with. So knowing the signs and symptoms, it's sometimes quite easy to diagnose these kind of degenerative changes that we usually come across clinically as an ophthalmologist. The etiology of pterygium is again very important. One should know what are the predisposing factors for the development of this pterygium. It's usually the hot climate, and sometimes the ultraviolet rays are basically responsible for the development of this kind of a degenerative change. People living in hot climates are more prone to the development of these pterygial changes that we usually come across. And then the responses to the exposure to the sun or the ultraviolet rays is again one of the predisposing factors for the development of this pterygium or this vascular or avascular triangular fold on the bulbar part of the conjunctiva. Obviously, as we've already studied, these irritative changes are going to affect the bulbar rather than the palpebral part of the conjunctiva, or rather than the tarsal portion of the conjunctiva. The environmental factors, for example, dry heat and high wind, are again one of the triggering factors, and they're going to be basically listed upon the causative factors for the development of this pterygium in a lot of cases. The exposure to the abundance of dust. So all of the causative factors that were responsible for the development of the Pinguecula are again repeated over here. So the etiology remains the same. For Pinguecula or for the development of the Pterygium, it's going to be the same kinds of etiology, whatever the final outcome of the degenerative changes are in the conjunctiva. The pathology or the pathological processes step by step would consider of the subconjunctival tissue that is undergoing the elastotic degeneration. So it's basically the degenerative processes that are taking place at the epithelium, or it can take place at the substantia propria, as well as at the level of the basement membrane. So these elastic degenerations, they are going to take place and they're going to give way to the vascularized granulation tissue under the epithelium. This vascularized granulation tissue is basically going to take up the shape of a triangular fold that is going to encroach upon the cornea slightly or slowly, and is going to involve the decrease in the visual acuity of the individual as well. Then the destruction of the corneal epithelium is going to start off. So it's just not going to relate to the destruction of the conjunctiva. After the encroachment on the cornea, it is going to destroy the corneal epithelium, the Bowman's layer and the superficial stroma. All of these are going to be related to the degenerative processes that are taking place at the conjunctiva as well as at the cornea. So it's basically a condition of keratitis, or it's basically a condition that is involving the cornea and the conjunctiva as well. Finally, relating to the clinical features of this particular fold, as you can clearly appreciate over here, this is a very clear picture showing a kind of a pterygium. When we're going to look at this particular picture, we're going to observe that there is going to be a head, then there is going to be an atypical constriction after the head, which is known as the neck, and the final body of the pterygium, or this vascularized tissue, that has started to degenerate the cornea as well as the conjunctiva. The etiological features or the predisposing factors are, again, it can be an age-related process that is taking place. It is more common in males doing the outdoor work. So the ratio, when we compare it, the female to male ratio, the male ratio is much higher than the females because of the exposure to the sunlight, exposure to the wind, and the outside work is also more common in males rather than in the females. Maybe unilateral, or maybe it's a bilateral condition. So the gender inequality is also present in its predisposing factors. The age, it's an age-related process. And finally, it can be a unilateral or a bilateral process that is taking place over here. The signs and symptoms would be the cosmetic intolerance. So the final complications or the final pictures would be, the final outcome would be a cosmetically intolerance that is seen in these patients. The only issue is otherwise it's usually an asymptomatic condition. Usually patients would not complain of any foreign body sensation if it's just a small tissue. But the only thing that would be hindering over here is the overall visual appearance of the patient. The foreign body and the diplopia is also sometimes observed. If it's encroaching the cornea, the visual acuity is also going to be decreased in these individuals. The foreign body sensation and irritation is seen in these patients, along with diplopia, that is basically the double vision phenomena, which is usually observed in these patients. The defective vision, decreased visual acuity, obviously after it encroaches the pupillary area, and is basically going to hinder the effect of the lens. So that is basically, if it's encroaching upon the cornea and if it is involving the pupillary area, the patient would also complain of decrease in the visual acuity. Primary double pterygium. So sometimes it is just related to the nasal side, but in a lot of cases, the temporal and the nasal sides both are affected, and it's quite a disastrous condition for the patient. Both nasal and the temporal sides are involved. The visual acuity is highly decreased. There is a foreign body sensation. Cosmetically, it's not tolerable. So all of these are the complications related to this kind of a degenerative change that is appearing in the patient. Regarding the parts of the pterygium, when we are observing the pterygium on a slit lamp examination, we'd be seeing the head of the pterygium, which is the most apical part on the cornea. Then there is the neck of the pterygium, which is a constricted part in the limbal area. Then there is a body, which is the scleral part between the limbus and the canthus. And finally, we have a cap, which is a semilunar whitish infiltrate in the front of the head. Now, the cap or the appearance of the cap is very important. Over here, we should just focus on the fact that the appearance of the fact is, or the appearance of the cap is indicative of the fact that it's some sort of a regressive kind of a pterygium that we're dealing with. If the cap is absent and it's the presence of the fugue spots on the cornea, it is indicative of the fact that it is some sort of a progressive kind of a pterygium that we are dealing with in this particular case. We have two clinical types of pterygium that we usually deal on with. One is the clinical kind of pterygium, and on the other hand, we have the progressive and the regressive kinds of the pterygiums that we're dealing with. The progressive kinds are the most notorious kinds of pterygiums that can be unilateral, bilateral, nasal, or temporal in their origin, and that are going to finally encroach upon the cornea as well as the pupillary regions of the cornea. So the final outcome in the progressive kinds of the pterygium would be a decrease in the visual acuity that is usually observed or that is usually complained of by the patients. The progressive kinds of pterygiums would be having the fugue spots or the islets of the warts. When we examine the pterygium, we're going to just observe this fact that this triangular fold is just encroaching upon the cornea, and just interior to the end of the head of the pterygium, there are going to be some whitish spots present that are basically known as the fugue spots, or they're also known as the islets of warts. There is the final appearance of the progressive kind of a pterygium would be quite fleshy, thick, and vascular in its nature. On the other hand, regressive pterygium is quite asymptomatic in the individuals. There is no increased lacrimation, no foreign body sensation observed by the individuals, as well as the visual acuity is also not affected in these particular individuals. There is little vascularity and no cap is usually present in these individuals. Interior to the head, there is usually a Stocker's line or a cemented line that is observed on the head of the pterygium, and that is basically the final outcome in cases of the regressive pterygium. It's very particular to the regressive kinds of pterygium. It's not usually present in the progressive pterygiums. On an overall appearance, the regressive pterygium is thin, it's atrophic, and it's accentuated in its nature. If this pterygium is left untreated, it can be a complicated situation that is observed in these patients. Either it can be a cystic degeneration that is usually observed in these patients. Then obviously the eye infections or the cases of the conjunctivitis are also sometimes seen in these patients. And finally, we can have the neoplastic changes to the epitheliomas as well. So educating the patient is again very important. We have to educate the patient that we cannot leave this particular condition untreated. It's always going to be treated either topically or either we can use the surgical excisions, which is the which is going to give the final prognosis to the condition. It's usually a benign condition, but if it's left untreated, it can be quite debilitating. It can decrease the visual acuity of the individual. It can lead to severe cases or the chronic cases of conjunctivitis as well, and it can lead to malignant conditions as well. So educating the patient is very important over here. The differential diagnosis would be or can be of a pseudopterygium. The basic difference between a pterygium and a pseudopterygium is the etiology. Pseudopterygium is basically an inflammatory process that is giving rise to this particular kind of a triangular fold. And in cases of pterygium or a typical pterygium, it's basically the degenerative causes that are the predisposing factors over here. Whenever we are differentiating the pterygium from pseudopterygium, we have to focus on the etiology of both. Pterygium is a degenerative process, and on the other hand, pseudopterygium is an inflammatory process. Age is very important. Usually it occurs in the elderly individuals, while on the other hand, pseudopterygium, it can occur at any age. The site that is usually, it's always situated in the palpebral aperture, and it can occur at any site. So pseudopterygium, it's not usually related to the palpebral aperture. It can relate to the bulbar apertures or the bulbar conjunctivas or the tarsal conjunctivas, or sometimes also exposed to its development of the pseudopterygium, because infectious states or inflammatory conditions can arise at any levels of the conjunctiva. The stages are usually progressive, regressive, and stationary when we talk about the pterygium, and in pseudopterygium, it's always a stationary case. The probe cannot be passed underneath a pterygium, and in cases of pseudopterygiums, probe can be passed under the neck. The treatment that is regarding or that is revolving around the pterygium is basically why do we treat these cases? What are the causes for the treatment of these cases? Is obviously the cosmetic disfigurement that it is causing, the visual impairment that it is causing, the continued progression, which can be even towards cases of conjunctivitis or towards the melanomas, malignant melanomas that can appear as complications. As well as diplopia or double vision is one of the complications of the pterygium. So we have to treat these cases foremostly. The recurrences of pterygium are very common. So we have to surgically excise with basically free techniques are used for this kind of surgical excision. Surgeries with amniotic plasts are also done. Surgical excisions with lamellar keratectomies are done. And then finally, the surgical excisions with lamellar keratoplasties are also done. Old methods are also used, which are known as the Mech-Reynolds operations, in which you basically completely excise the pterygium and it is basically replaced with the surgical implants for the cosmetic outcomes in these cases of pterygium. Pterygium excision and the steps for the excision of the pterygiums are basically, it consists of the dissection of the head from the cornea, first of all, and then basically there is the excision of the pterygium tissue under the conjunctiva. Finally, the CLAU after the excision pterygium is done. So it's basically the complete repair of the bulbar part of the conjunctiva from which the pterygium is being excised, and obviously we have to repair the scleral tissue underneath it and the conjunctiva above it. So all of these are surgically treated after the pterygium is excised. One of the other variants of the degenerative kind of conditions is the concretions. So concretions usually appears as the whitish yellowish spots, and it can involve the palpebral or it can involve the bulbar part of the conjunctiva. Usually they are confused with the fatty deposition that can take place, but it's not the fatty deposition, it's the deposition of the epithelia and the debris. The damaged epithelium, of course, and the debris that basically takes part and it basically gets deposited into the loops of Henle's. And that is basically the final outcome is this whitish yellow spots that appear on the bulbar, or it can be quite visible on the palpebral part of the conjunctiva. The clinical features relating to these kind of concretions they're basically very common parts of the degenerative kinds of conditions. May also be seen in the lower fornix or on the palpebral part of the conjunctiva. The yellowish white hard-looking raised areas, this is the final appearance of these concretions. They may produce the foreign body sensations in the eyes, and as well as they may even cause the corneal abrasions due to the continuous foreign body sensations that the patient would complain of. The treatment would also include the hypodermic needle under the topical anesthesias that is used, and the final excisions are done. Another variants are the amyloid degenerations of the conjunctiva. So this is basically the amyloid deposition. It can be a primary deposition of the amyloid, or either it can be the secondary depositions of the amyloid in the conjunctiva. The etiologies can be primary, that is the primary deposition of the immunoglobulins that takes place at the conjunctival levels. The deposition of the light chain IgGs are very important, and the secondary conjunctival amyloids are basically due to they are secondary to the systemic diseases. So it can be a case of amyloidosis, and there can be a deposition of the amyloid in the conjunctiva as well. The clinical features would consist of the amyloid material that is usually yellowish, well-demarcated and irregular material. Involved areas are the superior fornix and the tarsal conjunctiva, and the amyloid deposition is usually associated with the subconjunctival hemorrhages. So these can be the complications as well. We can basically categorize them in the clinical pictures or the final clinical features of the patient. The treatment would obviously consist of the lubricating drops for the mild symptoms and excision biopsy in patients with marked irritation. So if it's a complicated situation, we can consider surgery in these kind of patients as well. So in this particular lecture, we just summarized the degenerative conditions of the eye. Degenerative conditions are classified separately. They are just not confused with the infectious states or with the inflammatory conditions, because the entire pathology for these conditions is quite different. The etiological factors are quite different. So knowing these degenerative conditions would further clarify the condition when we have these patients of Pterygium or Pinguecula, Concretions or amyloid deposits. We would be knowing how to manage these cases of degenerative conditions particularly. So that is the end of this lecture. Thank you for watching Scalia.com.